I'm really thrilled to have the opportunity to have a few minutes to share with you what's happening here on diversity, equity, inclusion issues, and where we're looking for in terms of sort of building members of our team to be able to sort of create innovative models.
I do community-based participatory research with marginalized populations and those who face stigma with drug use disorders in order to add power to their voices.
HOPE stands for Healing, Opportunity, People, and Equity. And this is really an effort being undertaken by the University of Minnesota Medical School, University of Minnesota Physicians, and mHealth Fairview to make changes in our organizations in a coordinated fashion such that all the organizations achieve a more anti-racist stance.
As you know, diversity, equity, and inclusion work can't stop at a single program level, and this requires a concerted effort across the community.
Our work in the department is focused in really improving the care that we provide, as well as the experience of receiving care in our clinical sites, and also looking to reinvigorate the community engagement that we have, ensuring that we are employing a power sharing strategy and that we are authentically engaging with communities so that our initiatives and the work that we're doing is really driven by community needs and wants.
And what we decided to do was to have a storytelling event. And these storytelling events are an opportunity for us to gather as a Twin Cities community and share our stories of what it is like to be physicians at different points in training, residents, fellows, and attendings. And the idea is that by sharing our stories, we build community.
Well, I'm hugely proud to be part of the faculty of the University of Minnesota. I have deliberately chosen to stay at the university because of its commitment to diversity and equity.
One of the things I found incredibly appealing in terms of sort of University of Minnesota's School of Medicine and its residency training programs is how much collective talent is already here. How much work is already going in terms of restorative justice, in terms of implicit bias training, in terms of really sort of changing things up.
We've had great opportunities to collaborate with our clinical partners to advance agendas that improve resident education in the workplace and improve patient care for our communities.
In addition to partnering with others, we will also be addressing important structural and operational challenges that our organizations face, such that we can improve the environment that we all work in. And this includes our faculty, our staff, and importantly for our learners.
One of the things that I love about the graduate medical education community here in the Twin Cities is the willingness of leadership, and even very senior leadership, to be really creative about how we approach things in medicine and how we approach things in our education.
My goal is to sort of connect all these wonderful things so we actually have an orchestral sort of impact in terms of the things that we're doing.
The really cool thing about this, especially from the learner aspect, is that because our learners go out and work in other health systems throughout the Twin Cities, they can be very potent agents of change, and in so doing can really affect how healthcare is delivered throughout the Twin Cities.
I'm also proud to work at a clinic that focuses on meeting patients where they're at and understanding our patients' social determinants of health and learning to innovate and improve access to care for all colors and backgrounds, even during the times of the pandemic.
Culture is a learned behavior, which means as we have talented people joining us like you help us in terms of crafting the culture that we want it to be, to sort of transform medicine from where it was to where it needs to be.
We know that we can't have the best outcomes for the communities we serve until all individuals that are engaged in this work feel included, feel valued, and feel that they can bring their whole persons to work.
My devotion to diversity work and my belief in a flattened hierarchy, I see all trainees as peers and as colleagues. So I am immensely grateful for what community members, students, residents, and fellows have taught me and shared with me over the years.
Our Story Slam that we held in June of this year, the original theme was Reflections on Life in a Pandemic. A few weeks later, George Floyd was murdered, and we ended up having this amazing, powerful collection of stories that spoke of the dual pandemics of COVID and racism and the way that those intersect. It was a powerful evening and a wonderful way to hear each other's stories.
So my approach is to find the exemplars, the really cool things that are happening, find out the things that are good that we need to put some work towards to make it great, find out things that are just not happening that need to, and sort of pay attention in terms of our environment, of what is it like here. So what we're looking for in terms of incoming trainees, and quite frankly, I look at you all as sort of collaborators. You're the ones to sort of help us come in on the ground floor, really develop a model that makes a difference in terms of anti-racist, anti-sexist, inclusive models. So we're looking for leaders. We're looking for people who want to sort of come in and work together to sort of make this a reality as we sort of move this in a way that makes significant meaning.
We want to approach each other and with this work with curiosity, humility, and a growth mindset. And we're really looking for trainees to join us in this process because we view it as extremely important.
Basically, diversity work is never static. So I welcome you to join with me in that growth, with a smile on my face and with gratitude. Please don't hesitate to contact me, because I would love to share you more of my story and listen to your story.
We have an ongoing commitment as a community here in Minnesota to continue to listen to each other's stories, to continue to raise up the voices of people who have not always been heard. And I really hope that you will come and join that conversation.
Minneapolis was sort of the site that raised people's awareness that we have to have a new day in medicine. And we're working to create that new day, and we'd love to have you join us. Thanks.